concluding speaker, following which we'll have a discussion, is Dr. Rashmin Gandhi. Dr. Gandhi was with Shankar Nethralaya for many years as a senior ophthalmologist and neuro-ophthalmologist, and then subsequently he has branched out into different vistas which are both ophthalmic related and some of which are not ophthalmic related. And I think it's very valuable to learn something from him, because we are often very myopic in our view, especially at the postgraduate level. So let's see what else can await us beyond our post-graduation and beyond into our careers. Over to you, sir.
Thank you. Thank you so much, Devendra, and thank you for this very kind invite. I have divided actually my talk as to when you are at the cusp of finishing your residency, or when you have just finished the residency. You actually go out of a set pattern that we have followed right from the school. You know that after 5th standard, you'll be on the 6th standard, 7th standard. You know, after you finish your MBBS, you're supposed to take a NEET exam, go to post-graduation, you finish your MS. As soon as you finish MS, the life is open all around, because there is no clear pathway. And that's what causes confusion in most of us as to what should we do. Should we just go ahead and do some fellowship? If we want to do fellowship, what fellowship would be right for me? Should I just join a trust hospital? Should I join a corporate hospital, academic institution, government institution, start private practice? Are there any other vistas where we can earn money? So these questions come up because the life is open 360 degrees. There is no one straight pathway that we need to follow. So keeping that in mind, I have divided this talks into three subsets. One is, what are the options in clinical ophthalmology after we finish residency, and what are the pros and cons of those options? Can we look at beyond clinical ophthalmology, staying within ophthalmology but not really practicing ophthalmology? And are there any options beyond ophthalmology or beyond medicine? So usual dilemma, as I said, is do we need to write any other exam, government institution, corporate hospital? So let's look at fellowships. I mean, the other confusion we always have is to what specialty would be right for me. And the most popular one obviously would be cataract refractive surgery or cornea refractive surgery, because the number of patients that you get to work on is simply higher. And obviously it also comes with a very obvious financial benefit. But the problem is that it can get monotonous. After some years of practice, the intellectual challenge that you may encounter in your clinical practice would go down here, because it's machine driven and everything almost appears same after a point in time. So then why not we look at UVR neuro-ophthalmology, because so much of intellectual satisfaction. Each patient would be different, each patient would behave differently, would respond differently, would have a lot of diagnostic dilemma and whatnot. But the problem is it is again mainly an institutional practice, and nowadays it is also driven by a lot of investigation. So while it can really give you a lot of intellectual satisfaction, but the commercial value of these subspecialty outside the institution is questionable. What about VR and medical retina? Another high flyer where you get to operate on different kind of patients. There is enough money probably available. Are there any problems there? And I don't know. The problem, of course. So that's what probably your. Okay, we'll stop that here. So obviously the point I wanted to make is that while there are a lot of options for treatment, at this juncture the patient's visual acuity or correction might still be a little suspect. So these are some of the options that one would think of in when we are to do fellowships. A lot of us would know at the end of third year that, yeah, this is what we want to do, but sometimes there can be a confusion. You would be liking glaucoma as well, retina as well, and cornea as well, and obviously you can't do all together. A good way where you can find out as to what you really want to do is take a break of a year and just do general ophthalmology. When you start managing your patients yourself, when you're not seeing masters at work, but you're managing yourself, is where you may realize sometimes that this is something which I'm good at and I'm liking it. And what about these options? After post-graduation, should I do private practice, medical college, institutions, corporate hospitals? There is no clear answer, there is no correct answer. But if you're somebody who doesn't mind settling in a small city, money is a criteria, intellectual satisfaction not so much, then maybe a private practice would be a good idea for you. But if you really want to settle down in a metro, money is important, intellectual satisfaction not so much. Maybe a good corporate hospital might be a good fit for you, but you like teaching, you like research, you like to work on new things, then the fellowship or an academic environment would be a right pathway for you. What about passion? I mean, a lot of times when you go to some mentor, they'll always tell you, just follow your passion. But what is that passion? I mean, you can be passionate about multiple things. You would never know as to what is that passion that you need to follow. These are some of the tenets of what one can do with one's lives. Is that obviously you require money in some measure. What makes your life comfortable as per your definition, which can vary individually. A fame, obviously all of us want to be known in our peer group and also in the society as to who we are, what we stand for, and how we are transferring the skill that we acquire through our lives. Contribution to science, publications, you have the masters here who have really contributed to science with their original work, and contribution to society, you do high volume work or you help out people. So these are, I think, the basic tenets which might give you some satisfaction as you go for your work. But as I said, life 360 after post-graduation, where everything is open, you really require a lot of discipline. That's something which you need to have, saying that, okay, this is a pathway that looks good for me, and you're allowed to change at some point in time. But to follow that pathway, you require a discipline, because nobody is going to tell you that after first year you have to study this to be in the second year, because everything is open for you. And there are no excuses, of course, because everything is your decision now. It's a very exciting phase for us to be in India. I mean, in 90s, everybody was looking at the greener pastures in the Western world, UK, US, go settle down there, because we were constrained with the way we practiced medicine because of the resource constraint, the technology, the money. But all that is changing. In fact, and that's the reason why we are running this course, because a lot of people would like to write these exams and go and settle down somewhere else. But I think it's slowly changing. We have an access to the best technology. We are producing technology in India now, and maybe next decade we'll have our Indian machines, which probably will be more popular in all domains. So it's great to be in India. So are there anything else that we can do beyond clinical ophthalmology? Indian School of Business in Hyderabad, IIM Calcutta and IIM Ahmedabad, they have a specific MBA courses, 1 and 2 years. IIM Calcutta it's a resident course, while ISB it's a weekend course. I mean, it's a full-time course, but you need to be there only on a weekend. And you get the MBA from some of these very good institutions. Where would it help you? You can become an administrator, you can be a CEO, you can run large organizations without really having to have an access to capital. There are eye care chains in India where the CEOs or medical superintendents are ophthalmology who have given up their clinical ophthalmology, are MBA, and are actually managing 70, 80, 90 hospitals across India. There is also a good opportunity to be an eye care entrepreneur. You can start your clinic. You may not be fully trained in all specialties, but now there is an access to a lot of money, the investor money, the people would be willing to invest in you if you can convince them about your passion and your direction, and you can start your own chain and have specialists work for you. There are a lot of these very interesting, not full-time but a small-time project-based avenues which will give you a lot of money. You know, you can be a key resource person for somebody who's just doing a market survey. You can get a call and they'll take you around 1 hour of yours, and they'll give you 15, 20,000 for that 1 hour, and they'll ask you relevant questions. They obviously would have to establish that you are qualified to answer those questions. The questions can be, you know, what IOL are popular and how do you use IOL or machine or whatnot. There are fintech companies like McKinsey, PwC. Now they have healthcare verticals and they employ doctors, and there the pay is really good because they pay you as what they would have paid in somebody in the US. So they are like really very good pay, but obviously you are completely away from clinical work. You're basically guiding them. You are bridging the gap. They know everything about the finance. They don't know much about the clinic, and you become the resource person to bridge that gap. Same with the tech companies. There are a lot of tech companies. Partho showed some beautiful websites. Obviously, some of these animations and videos are made by technologists, but they don't know, you know, which layer of brain, how is the pupil pathway activated. So they require that knowledge from you, and they nowadays pay quite well for that kind of resource. And what about something completely different. I have a friend of mine, he's not an ophthalmologist, but a doctor. He learned, and Partho mentioned about ChatGPT. So some of these generative AI now can generate code for you. You don't need to know the coding. If you know what your questions are, you don't even need a coder. I mean, within half an hour, you'll know or learn how to do a basic coding. So AI-driven solution. So he has given up his MBBS. He started his AI company, and now that company is valued at 100 crores. So basically, you have now options to start something which is related to ophthalmology or related to preventive health, which can get you a lot of money. So in other words, it's very exciting era to be in. The technology is helping us to really chase our dreams. But obviously, we need to be very clear as to what really excites us and what probably would justify our existence, our brief existence on this planet. Thank you, Devendra.